Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Today, consumers have a lot of information right at their fingertips, just a click away on the World Wide Web. Now, when it comes to mental health care, there's also a lot of material and advice out there. But how do you know if you're going to a reputable source to get the help that you need? And can online sources be helpful, or is in-person therapy still the best, the gold standard?
Here to discuss is Mayo Clinic psychologist and co-chair of Mayo Clinic's Division of Integrated Behavioral Health, Dr. Craig Sawchuk. Welcome back to the program, Dr. Sawchuk.
Great. Well, thank you for having me back.
What exactly is integrated behavioral health?
It's an impressive title.
Well, thank you. We figure the longer the title, the cooler it looks or sounds. But really the idea of integrated behavioral health is to move mental health resources right to the point of care where people get their care, which is in primary care, family medicine, and pediatrics. So we have a combination of psychiatrists, psychiatric nurse practitioners, social workers, nurse care coordinators, and psychologists right in primary care to really help elevate all elements of a person's level of care right there. And it not only helps with access for people getting in for treatment, but it really helps with coordination and communication with our primary care teams.
It makes sense to go to primary care if you need your flu shot or my elbow hurts when I'm doing this. But to say my brain isn't working the way I think it should be working, are patients getting there? Is that happening?
Oh, very much so. And when you think about like the natural course of people struggling, with difficulties, I mean, mental illnesses are about affect 30% of the population really at any point in time. When people are struggling, their first thought is not like I got to go see a clinical psychologist at a department of psychiatry. No, they show up in primary care and they work with their primary care docs. Initially, it may look like more physical symptoms that they're struggling with feeling stressed or insomnia, but it's not uncommon that mood problems show up way earlier in their course of care in primary care than specialty mental health clinics. So it's a great opportunity to be able to move that care where people are most likely to go.
And it's the team approach, which Mayo Clinic is so famous for.
Exactly. And I think that this is what's great about the history and the culture of Mayo Clinic and doing multidisciplinary work where you're leveraging the skills and experiences of your team members to help individuals. I think this is an excellent example of this.
So for those people, listeners who don't have access to a team like yours, how do you go about finding a good mental health care provider?
Yeah, and this is what's really tricky because in my line of work, what flies as mental health care can look very, very differently. So simply going online, say to Psychology Today and typing in therapist, you'll get a list of a ton of different people who say they do a ton of different things, but it really, really varies. And I think this is where I see some departure of mental health looking different than some other aspects of our healthcare that, we have evidence-based treatments for diabetes and cardiovascular disease, and we have evidence-based treatments for mental health conditions, but it's remarkable the tolerance that happens in the field for non-evidence-based things continuing to end up out there.
Are there any reputable sites on the World Wide Web? I mean, if somebody said, where should I go, or where could I go, or what site might be helpful, what would you suggest?
All right, so beyondmayoclinic.org, which is awesome. So we definitely like that one. But there are some great mental health sites. A couple of my favorite ones actually are the Association for Behavioral and Cognitive Therapy, so abct.org. The other one is the Anxiety and Depression Association of America, which is adaa.org. What's great about those sites is they're constantly updated with the evidence base. There's excellent resources, informational resources for patients of all age levels that can be really helpful. And they also have Find a Therapist locators. So the types of mental health providers that tend to operate according to the evidence base tend to belong to those organizations. It's certainly not an exhaustive list, but those are two really good places to start. Because I understand it from a consumer standpoint. When we're looking for healthcare, we don't go on to PubMed and research the evidence base, behind it. We're assuming that because they're professionals that they're going to be doing evidence-based work for us, but that may not always be the case.
What about once someone does get pointed in the right direction? Often when you go to see a doctor, you want to find out what's wrong. But when you go to see someone for mental health, okay, finding out what's wrong, that's fine and important, but what to do with that information and how to go forward. How do you get the most out of the therapy time that you have when you're seeing someone?
Right. So this may sound a little bit weird, but treat your consumerism for a therapist like you would a car. Ask questions. So some of the things that we think about are typically components of good therapy. Does the therapist assign homework? Is there actual work you need to do in between session? Setting up treatment goals. What are the progress towards treatment goals? How do we know that we're moving in the right direction? Is there actual structure to what they do over the course of a given session? Because we think of there's a variety of different psychotherapies out there, and there are two factors that we tend to pay attention to. One are what are called non-specific treatment effects. These are just the things that are shared across all different kinds of therapies, like support and empathy. Coming into a professional office, it gives all those psychological features of this person knows what they're doing. But then there are the specific or the active treatment effects, and that comes from the science, the things that we know that can be helpful. So we take anxiety disorders, and on the show we've talked about this before, is the number one treatment for clinical anxiety is exposure therapy. However, that tends to be the least likely utilized treatment principle that's out there. A lot of times when patients are coming in with anxiety disorders, people may be doing relaxation strategies, which are helpful to a tiny little bit, but exposure therapy is our most important element. So kind of knowing what the evidence base is can be really helpful. And that's why as a consumer, if we can get educated from some of these online resources, then you can ask the right questions when you're interviewing a provider.
That's perfect. You need to go to someone who knows what they're doing and is knowledgeable in the condition that you have.
Exactly. And you shouldn't stand for any less. And you know, again, the evidence base, people like vary in terms of providers. Sometimes it may be a function of their education. They were trained at a different stage and maybe didn't have as much access to the evidence base. And so maybe it's a continuing education thing. However, some providers don't believe in the evidence base, which boggles my mind. But you want to be a good consumer of your care, and it's tough to put that completely on the consumer themselves when they go out. So that's why going to those websites that I mentioned earlier on can maybe help give people a better sense of, well, it summarizes what the evidence base are. What are the things you want to ask for, and ask them how they do it.
You mentioned websites. Before, when you've been here, you've talked about apps.
Yeah.
Throw out a shout out for your apps that you mentioned.
Oh, there's actually like a really, really great clearinghouse website. There's this website called Cyber Guide, and it's pronounced PSYBERGUIDE.org. So cyberguide.org. And this is developed by a psychologist out at the University of California, Irvine. And he's done an excellent job with rating mental health apps and keeping up to date with them. So they do nice summaries of what's the evidence base in terms of the app itself. Has it been tested in that delivery? Are they supporting types of interventions that actually do have an evidence base? What is their privacy policy and transparency? How is data protected? Because some of these apps now share information back and forth between the patient and their provider. And aesthetically, usability, how helpful is that? That's a great resource.
Okay, the app is cyberguide.org, PSYBER guide.org, all one word. And the two websites that you mentioned are abct.org and adaa.org.
That's right.
You've been most helpful.
Awesome. Thank you.
All right, we've been talking about tips on how to be a good mental health care consumer with Mayo Clinic psychologist and the co-chair of Mayo Clinic's Division of Integrated Behavioral Health. We now know what that means. It's Dr. Craig Sawchuk. Thanks so much for being with us, Dr. Sawchuk.
Great. Thank you for having me.